Hi there everybody, I'm Dr. Chad Stelner from Live Well Chiropractic. I have Sarah with me here today. She's going to be my assistant. And what I want to do is talk about carpal tunnel. One of the things that we get asked a lot about as chiropractors is, can you help carpal tunnel? And most of the time the answer is yes. Obviously we need to do our exam here to see exactly what's going on. But I want to talk to you about what we do for that as far as chiropractic wise, and also with ART. I'm being a certified active release technique provider. And there are certain things that we can do soft tissue wise to help alleviate carpal tunnel symptoms. So first off, come on in, Heather, zoom in here. So carpal tunnel is this little tunnel that is in your palm here, and through it run tendons and blood vessels, and specifically the median nerve. So this I've kind of drawn on here, the path of the median nerve. And the median nerve essentially comes off of your neck, runs down through here, comes over the top of the elbow, runs down through your forearm, and starts to branch once it gets to your palm, and it goes to your thumb, your index finger, your middle finger, and part of your ring finger. So the first part is when we're talking to a patient about carpal tunnel is we're getting their history and seeing exactly what symptoms they have. If they're having whole hand numbness and tingling, it's probably not carpal tunnel. Could be, but there's some other things going on. Specifically, you're going to get numbness or pain or weakness typically in these three fingers, and that's kind of the main thing. And from there we can look to see if there is any type of impingement in the carpal tunnel from an overuse type of injury. You know, sitting at the computer, keyboard is the most common one, but also anything where you're doing a repetitive action with your hands. And from a chiropractic standpoint, we start to look at the wrist, and we see how those little wrist bones are aligned and how they're moving and functioning, and we can look at the movement and the motion at the wrist. With ART, we're looking more at the soft tissue. So there are certain entrapment points. There's actually 5 common entrapment points of the median nerve from the elbow down to the hand that we can release if the median nerve is trapped there. We can start to look first, it's kind of in the thumb muscle here, and we can feel a little nodule in there if that's the case. The second part is actually in the carpal tunnel itself, and there are certain things, maneuvers we can do, protocols that we can use to try to release the nerve there. The other parts are up further in the forearm, and they actually get entrapped in the muscles. So it's what we call a peripheral nerve entrapment. And you think of the nerves running through your body, and they essentially run through the muscles in the soft tissue. Just like how your wires and your walls run through all the studs, they do the same thing. So if the muscles get tight, they can essentially entrap the nerve as it runs through there. And the nerve is not elastic, meaning it doesn't stretch. Where the muscles here obviously can stretch and flex and back and forth. So the principle behind it is we find where it's entrapped there, and we essentially try to pin it, and then we lengthen the muscle to try to free up that nerve. And the unique thing about ART is it works very quickly. It works very well. It's easy to do. It's not painful or uncomfortable. And we usually get really good results very quickly. We can also look at other issues. People that typically have carpal tunnel have other issues going on within the wrist and the forearm and even the hand, and we can work on that to get that resolved. So if you guys have any questions about carpal tunnel, feel free to shoot us a message, give us a call, talk to me directly if you need to. If you know someone that's having some carpal tunnel issues, give the video a share, and maybe they can look at it and watch it, and give us a call if we can help. Thanks.